Okay, this video is called Anti-Cancer Checklist, and this is just for educational purposes. A lot of people ask me, what can a person do to lower their risk of cancer? What can a person do when they have cancer to improve their prognosis? And if you're seeing a doctor for treatment of your cancer, make sure you talk to them and work out everything so it ends up being, overall for the best. But just some things that have been shown to potentially be rather helpful to cancer patients. First of all, no meat, not one bite. And none of this everything in moderation. That's for chumps and losers, okay? You want to say, biblical thinking, thou shalt not eat meat, not another bite the rest of your life. Meat increases the risk of cancer in like over 30 ways. I previously had studied it, and I stopped counting after about 32 ways. Okay, it's got a lot of saturated fat causing tissue hypoxia, methionine, an essential amino acid, sulfur-containing amino acid that cancer needs to grow. It's got a lot of leucine, much more than plants, which increases activity of mTOR, mammalian targeted rapamycin, the nutrient-sensing pathway that tells cells to replicate, so that's bad. Tends to have a lot of iron, especially, for example, in beef. The red meat's got more myoglobin. The iron will also increase activation of mTOR, the growth pathway to make cells replicate. You don't want that. Decreased dietary protein overall. I haven't seen a paper saying you should decrease beans, but I would decrease beans just because they got tons of protein. Typical beans got about 25 to 30% protein. And I think you really want to lower your protein intake. In general, we don't need more than about 3-4% protein. So being way up there, I think you're potentially feeding cancer through the back door with glutamine. It can go into the bottom of Krebs cycle, if you will. And Krebs cycle can even run in reverse. So you don't want to be throwing more protein at your body. Okay, no dairy, not one drop, none dairy, forget it. Nothing ever again that comes from an animal, dairy or meat, anything, any animal. And that includes no eggs, nothing from an animal. Because it increases insulin-like growth factor, which can lead to activation of mTOR. Dairy often has a lot of estrogenics in it. The cows are now pregnant while they're making milk, and you don't want that. As far as water, you want to definitely filter your water. The best thing would be to have water that doesn't contain F-. Reverse osmosis can remove it. Distillation can remove it. I've got other lectures on water if you're curious about that. Water from a municipality will tend to have a lot of estrogenics in it. It's too expensive for them to remove ethinyl estradiol, birth control pills, and a lot of other estrogenics, BPA, atrazine, etc. So at the very least, you want to filter your water. The very least would be a carbon filter, which removes the estrogenics. Carbon filter won't necessarily remove some of the other things. Typical municipality will also put aluminum in the water. You don't want that either. So you want to optimize everything to be healthy for your body so your immune system will function optimally. It's your immune system which clears the cancer from your body or suppresses it. Okay, you want to decrease dietary fat, especially your sat fat and your omega-6 fats, because it helps you to avoid insulin resistance. Insulin resistance will lead to increase in insulin-like growth factor, and that'll lead to increased mTOR. So you don't want that. Okay, even omega-3s in excess are bad because omega-3s in excess can suppress the immune system. There's a couple papers on that. In general, you want to minimize dietary fat. We've talked about this before, but basically it's impossible with any naturally chosen diet to be too low in protein or too low in fat. So don't even worry about that. Those are non-issues. I've got previous lectures on that. Dr. McDougall lectures on that. If you study nutrition, that becomes quite clear. Okay, no oil, not one drop. And again, just like Dr. Esselstyn says, not one drop. All oils are bad. There aren't any good ones. Olive oil is not good for you, okay? They tend to increase oxidative stress, tend to push towards obesity, tend to make the blood thick, if you will, increase viscosity, promoting tissue hypoxia and atherosclerosis. I got previous lectures on that. I think it's good to have a HEPA air filter in your house. And in general, avoid toxic chemicals. If you're exposed to toxic chemicals in your job, your neighborhood, or whatever your context is, try to avoid them as best you can because they'll just create an extra burden for your immune system to deal with. You want your immune system focused on controlling your cancer, preventing a cancer. No caffeine, not one drop, because caffeine will decrease your sleep. Even if you slept the same number of hours, you won't sleep as deeply. It has a half-life of 6 to 8 hours. I got videos about how to quit caffeine. You don't want it. It's not good for you. I used to drink coffee, 1 or 2 cups a day for like 15 years. I finally quit, and I'm so glad that I did. It took a while to get off it. I got a video on how to quit caffeine, but it's not your friend. Everybody says, oh, I'm too much stressed. I want to reduce my stress. Well, coffee raises the same hormones as stress, increases your catecholamines and your cortisol, so you don't want that. Okay, minimize your sodium intake, your salt intake. Sodium is typically sodium chloride. The sodium is bad because it's a vasoconstrictor, inhibits endothelial nitric oxides. That can cause tissue hypoxia. Hypoxia creates a milieu that sort of favors cancer. Cancer grows better in a hypoxic, that means lack of oxygen, acidotic milieu. So sodium is bad. Chloride's also bad. And again, so this is why you're avoiding salt, sodium chloride, because the chloride will displace bicarbonate from the blood. And they're both anions, and you have to balance the anions in the blood. So once the bicarbonate is displaced, it'll decrease the ability of the blood to buffer the pH, leading to a mild metabolic acidosis. Not good. Kind of creates a little bit of a favorable milieu for cancer. Okay, and you can dramatically reduce sodium. You know, we're the only animal on the planet that eats more sodium than potassium. Okay, your plant foods have tons more potassium than sodium. You know, it's pretty routine. They're 10 times more, 100 times more, even more than that. P for potassium, P for plants. You want to be high in potassium because it's a vasodilator. As long as you don't have kidney failure or something, that's the way to go. Okay, look at some whole food plant ingredients, and you'll be amazed at how much more potassium there is than sodium. That's good. Also, you get magnesium. Magnesium is right in the center of chlorophyll, just like iron's in the center of heme with meat. Magnesium's in the center of chlorophyll with plant foods. That's good. Magnesium, like potassium, is a vasodilator, and you need it to run your sodium-potassium ATPase pump. Magnesium is a cofactor. It helps to stabilize the ATP because the phosphates with their strong negative charge want to pull apart from each other, and magnesium bridges them with its positive charge. Okay, you want to lower your serum ferritin. Ideally, you definitely want it less than 100, preferably less than 80. Ideally, it's probably in the ballpark of somewhere like 25 to 50. Some people are okay with less than 25, but less than 25 can potentially cause restless leg syndromes. And the reason for that is you want to minimize any free iron in the blood, or intercellular as well, because free iron can lead to ferrous redox cycling between Fe2 plus and Fe3 plus, and that can cause oxidative stress, which can damage DNA, can damage mitochondria, and cause other problems. You don't want that. It can lead to the Fenton reaction, Fe for iron, Fe for Fenton, producing hydroxyl radicals, which can be damaging to mitochondria. You want good mitochondrial function. That favors normal tissues over cancer cells. Okay, the best diet, you all know this if you've heard my site, is 100% vegan. 100% vegan, okay? No exceptions. Whole foods are better. I don't eat anything that has more than one ingredient. I almost never eat anything that has a label on it. About the only thing I'll ever eat with a label on it would be, you know, something like, I'll occasionally eat plain oatmeal with water, for example, but that's it, okay? Always organic, 100% organic. Low fat, like we talked about, low sodium, no MSG or MFG. That's why I don't eat bread anymore, because unless you make it yourself, it's pretty hard to find a bread that doesn't contain oils or MSG or MFG. MFG is manufactured free glutamate, which is like MSG. Okay, no caffeine, no alcohol, zero, not one drop. Alcohol is bad for you. Any amount is bad for you. It's a tumor promoter. No tobacco, no sweets, no foods with more than one ingredient. Okay, fruits are alkaline. That is good. I would consider doing Dr. Esselstyn's new thing. I mean, he's been talking about it now for almost 10 years, this idea of eating greens 6 times a day. What Dr. Esselstyn says is as we get older, our endothelial cells, artery lining cells, produce less nitric oxide. A lot of that's because people had a bad diet, because people have normal blood pressure in their 70s if they eat in a plant-based diet all their life. But still, there's some decrease in the body's ability to produce nitric oxide from the arterial endothelium, such that if you eat greens, you get this secondary nitric oxide pathway whereby the nitrates in the greens that you eat are converted to nitric oxide through your mouth and in your stomach. And you get more systemic nitric oxide, meaning nitric oxide to tissue that's beneficial. Also from sunshine, you'll also generate more nitric oxide that's systemically distributed. So that's also beneficial. I think that's why it feels good to go out in the sun. And this creates a better milieu that favors your normal cells over the cancer cells. Because that's kind of what cancer is. It's like a cell that has transformed itself to become like an anaerobic bacteria, just out for itself to grow. And it's in competition with the neighboring cells around it. There's like a fight going on. And good oxygenation of tissues and a relatively alkaline milieu, that favors normal tissue. And that's thought to help the immune system do its job and lead to the good cells growing and thriving and the cancer being suppressed. Okay, get more sun. It gives you the good vitamin D. Much better to get your vitamin D from the sun. And like I said, it also increases production of nitric oxide that is systemically means throughout the body distributed. That's why it feels good when you're out in the sun. It's actually a wonderful feeling, isn't it, to be out in the sun and to walk in the beach in the shallow water. I mean, It's about as good as it gets. And with someone who you like, okay, that's great. All right, we don't get the opportunity of that as much as we'd like. Okay, increases good salvation of endothelial glycocalyx, yes. Anything that maintains glycocalyx tends to be good because an intact glycocalyx, which means the lining of your arterial lining cells, your endothelial cells, helps prevent metastatic cancer from being able to adhere to those cells so it can't then grow in a new location, okay? So an intact endothelial glycocalyx, meaning the surface coat, sugar coat of the endothelium, helps prevent metastatic disease from securing a landing site. Okay, you want to exercise a lot, all right? Exercise increases something called the AMPK pathway. AMPK stands for AMP as in adenosine monophosphate. That's a single phosphate, you know, in comparison with like an ATP, adenosine triphosphate. So adenosine monophosphate activated PK, protein kinase pathway. And so what this really means is your body has a seesaw between high energy level and high food resources or low energy level. And when you exercise, you tip yourself into the low energy resources. But that's good because your body says, hey, we just worked out, had a lot of exercise, we're tired, we're low on ATP, we have to go into a maintenance phase and restore our energy reserves of ATP, for example. That's what you want because it shuts off mTOR. When food is abundant, you know, a typical fat American eating tons of protein, tons of fat, the mTOR gets activated and says, hey, now's a good time to replicate. We got tons of food available. And that also increases the replication speed and progression towards, you know, fatal cancer. So you don't want that. You don't want that. Some of the greatest cancer super survivors are people who exercise like crazy. Ruth Heydrich was a lady who was diagnosed with metastatic breast cancer at around 40 years of age, and I think she's like, you know, she's lived over about 40 years or more, running triathlons and marathons. She's world famous record holder, and all that exercise, not only does it activate your AMPK pathway, she works out every morning. It also gets more lymphatic flow in your body because your muscle contraction is what gets lymphatic flow to occur. Okay, there's no heart on the lymphatic system. It's skeletal muscle contraction. All right, so that's what you want to get going. This other lady, real famous, Janet Murray Wakelin, she survived metastatic breast cancer for over 20-something years now, and she ran, you know, daily 365 consecutive marathons along the perimeter of Australia. And there's been other ones who've had similar type approaches. So anyways, exercise really helps, all right? Stop doing the things you don't want to do. Don't waste time. Don't waste your time on trivia or distractions. Consider retiring from your formal job so you can focus more on healing. If you've got a support system, maybe, you know, move back with your parents or figure out how to do that. That's up to you. I kind of think it's good to be warm. I don't know this for sure. I don't have proof of this, but I just sort of think, you know, the immune system works better when you have a fever. Maybe it works better if you just keep yourself warm most of the time. I know blood viscosity, blood thickness decreases when you're warm, which tends to improve tissue perfusion, tissue oxygenation by blood flow. Blood flow is the river of life. You want to keep that optimal as well. And you're going to want time to read, okay? It takes cancer a long time, usually, you know, a decade or more before it becomes diagnosable by conventional imaging methods. So you want to take some time to read and figure out, you know, I would read all about all the people who are super survivors, you know, read the books by Heydrich, Janet Murray Wakelin, watch their videos, Chris Wark. There's other books here too, Radical Remission by Kelly Turner, China Study by T. Colin Campbell, etc. Stop Feeding Your Cancer by Dr. Kelly, etc. Okay? And see if you get an idea from them. Plus, just being around people who've already been successful at what you're trying to do, it's inspiring. It brings hope, and it gives you some ideas that might help you. Forgive the people who've mistreated you in the past. We all have some people who annoyed us, or maybe that we annoyed, and, you know, don't waste your energy on resentments. That's better for your sake, okay? You want your energy focused on healing, not on that kind of stuff. Better to have an attitude of gratitude. Spend more time with the people you love and positive people. They make you feel good. That lowers your stress level. You might want to make an audio or video summary or like a PowerPoint lecture of your family history for your children or for your nieces and nephews. It's good for children to know their family history. You might enjoy doing that, going through your old photographs and whatnot. Focus your time on things that matter, your purpose in life. Do things that help other people. When you help other people, you help yourself also because you release these reward neurotransmitters, and I think it sort of tells your body to go on living longer. I think it just does. And also, when you do the thing that you think you were sort of born to do, you feel happy. You feel a sense of fulfillment. You feel that, you know, this is right, and that is a good thing. Religion is very helpful to a lot of people. I've known a lot of people, super survivors, that felt religion played a major role. I know it was very helpful to my mother, for example. My experience with Christian art and music is that is an incredibly beautiful and soothing and positive, and I very much enjoyed my time I spent with those things. So find out how that can be beneficial for you. Let's see, what else? If there's some way to track your progress, that can be helpful. For example, with prostate cancer, you can check your PSA level, and if a certain diet and lifestyle is getting your PSA to go down, like the Ornish study showed that that can be done with low-grade prostate cancer, then keep on doing the things that are helping. Don't do the things that seem to be unhelping. If your PSA bumps up, then stop doing whatever you did the month or so before that. Okay, for some people, it'll be going by how they feel. For other people, it'll be a follow-up CT scan. That'll depend on your own personal situation. So anyways, just wanted to make a quick summary of things an individual can do. This is just, you know, for your educational purposes, not medical advice. Make sure you talk to your doctor about whatever you're doing. So I hope this helps.